There are 3 things you need to know as a direct support professional, DSP, in handling a client with COVID-19. Number 1, who is at high risk in contracting the virus? 2, how can you protect yourself, your client, and others? 3, how to manage a client with COVID-19. We're First Choice Family Services, and in this video, we're going to show you how to handle a client with COVID-19. Who is at high risk for contracting the virus? The Center for Disease Control and Prevention emphasized that people with developmental disabilities, DD, are not naturally at high risk for being infected from COVID-19. People with disabilities who have serious underlying medical conditions are identified at high risk of serious illness when infected by the virus. It might get complicated because some developmentally disabled people might have difficulty in communicating symptoms. Others with developmental disabilities might process information differently and understand the COVID-19 situation. At times, it might be a challenge for direct support professionals to make their clients aware of what's happening and assist them in prevention techniques. Even when clients don't have serious underlying medical conditions, they're still at risk. The coronavirus disease is a respiratory illness that spreads from person to person. The ongoing spread in the U.S. involves everyone and places the DD community at high risk because of the need for physical support in their homes. It is important that direct support professionals prioritize their safety so they can assure their client's safety. How can you protect yourself, your client, and others? The best way to avoid contracting the virus is to limit your exposure. The Center for Disease Control and Prevention, CDC, lists precautions everyone should take seriously to avoid virus infection. Here are the highlights. Wear a mask to protect yourself and slow down the spread of the coronavirus. Stay at least 6 feet or 2 arm lengths from people you don't live with. Wash your hands often. If soap and water are not readily available, make sure to sanitize with a 60% alcohol solution. Avoid touching your eyes, nose, and mouth with unclean hands. For direct support professionals, it is important that they religiously practice all of these procedures, including cleaning and disinfecting shared spaces or commonly used things. We should all be responsible for monitoring our health in cases where we feel sick. So pay attention to the symptoms and watch out for fever, cough, shortness of breath, loss of taste and smell. Refer to this complete list of symptoms from the CDC to double-check your situation. If any of the symptoms persist, take your temperature and monitor your symptoms. Immediately isolate yourself from those you live with and ask them to do the same. Inform those you came in close contact with about your situation and contact your doctor to seek medical care. A complete guide on what to do is also posted by the CDC. How to manage a client with COVID-19. Now we've reached an extremely important part of the video. It focuses on a client contracting the virus and how to handle them in this situation. The CDC creates a guide for direct service providers caring for the developmentally disabled with COVID-19 in an in-house setting. Below are a couple of the important points you should observe in handling a client with COVID-19 as their DSP. Always take your temperature before the start of each shift. Stay home if you have a fever of 100.4 or greater. Screen all clients on the phone and ask about symptoms consistent with COVID-19 or exposure to a person with COVID-19 before each visit. Wear a mask as appropriate. Provide support and help cover basic needs as part of your client's daily routine. Make it a habit to wash your hands before and after every task. Do not touch your eyes, nose, or mouth when working through tasks. Watch out for emergency signs and symptoms that might develop with your client. Call their doctor if needed. Limit contact with your client. For tasks that they can be fully independent with, monitor them. For others, where they need physical assistance, provide support, prioritizing safety. Maintain distance if possible. Avoid eating together or sharing personal items like silverware, towels, or other gadgets. Clean and disinfect all high-touch household spaces, surfaces, and items often. Avoid cleaning the area around your client if possible. Just supervise if applicable. Have a dedicated trash bin for your client and be cautious with their items and their dirty laundry. In any case, whether you are in the client's home or after you finish your shift or leave the home, if you develop symptoms consistent with COVID-19, keep your mask on. Inform the client and their family. Leave their household if in mid-shift. Self-isolate and inform your service manager. Arrange for medical care and testing. Conclusion: it might be a lot to take in, but these precautions and guides will definitely go a long way in slowing down the spread of COVID-19. Recognizing that your client needs all the help they can get to get through this situation, and set yourself up as a DSP who prioritizes safety. The longer you keep yourself safe, healthy, and COVID-free, this increases the chances of your client having an improved quality of life. Even in a situation where our client contracts COVID, he needs you more than ever. Now it's your time to move. If you feel like entering the DSP industry, it could be for you. Also, here are 4 more ways we can help you. Get services. If you have a developmentally disabled family member who needs support, please click below or in the description to get uncompromised DSP services. Become one of our staff. Remember that the First Choice Family Services doors are always open for results-driven professionals. Feel free to show your support to the developmentally disabled community by donating or participating in our charity and campus ambassadors programs. Get involved. Be social. Finally, get in touch with us through our social media channels to be updated on the news in the DSP industry and the developmentally disabled community. And if you like this video, please share it with your friends in need of a job after you subscribe. Thanks very much for watching. And remember, First Choice Family Services is your information resource for the DSP industry. Like, subscribe, and hit the bell notification so you can stay connected.